Okay, Assalamualaikum warahmatullahi wabarakatuh. So today our group will present about case presentation for Toxicology PBL 1. Okay, so first for the outline presentation, okay, we have case summary from trigger 1 and trigger 2, and we also present about the marijuana, about its route of administration and its effects. And lastly, we are going to conclude and also include the Islamization. Okay, so for the case summary from the trigger one, there are 23 years old male went to emergency, then complained that he had palpitation, chest tightness, dizziness, and headache. And also he claimed that he taken no drugs, and also he vomit then one time. Okay, and then he also feels very hungry. So that is from trigger one. And from the trigger two, okay, the other symptoms is he looks pale, agitated, and very anxious. And also neurology examination also show that GCS 15. Okay, so the plot twist is his lungs are clear to auscultation. And also he had a normal result of clinical examination, except for hypertension. Okay, so for the discussion, okay, from the kids, okay, we observe, okay, from the evidence that tell from triggers, okay, so he claimed that he inhaled something. So from this evidence, we assume that he had acute toxicity with short-term exposure. Okay, and then he also have symptoms like palpitation, chest tightness, dizziness, and headache. And then he vomit more than once and feels very hungry, looks pale, agitated, and very anxious. Major signs and symptoms related with marijuana that we'll explain later by our friends. Okay, for the examination, okay, neurology examination shows GCS 15 that show mild brain injury, that is marijuana or THC can be major risk factor of mental health problem. So this also is will explain later by our friends for more details. Okay. So acute toxicity. What is the acute toxicity? So acute toxicity is adverse effect because of the administration of single dose or multiple dose within 24 hours. Acute toxicity also is inhalation exposure in the short period of time, which is less than 24 hours and usually for 4 hours.
So my name is Shahmin Nur Amira binti Shahrudin. My metric number is 1912038. So today I will continue the presentation from Sister Hayati just now, which she mentions about the summary of our group discussion that leads to the idea of marijuana, which is it gives us acute toxicity. So basically, what is marijuana? So marijuana, also known as cannabis because it came from the cannabis plant. So marijuana is basically a psychoactive drug. We can say that. So what is psychoactive drug? Psychoactive is a term that applied to some chemical substances that can change a person's mental state by affecting the way the brain and nervous system works. So we can see that marijuana, which can also be called weed, pot, dope, ganja, or cannabis. And then marijuana is a dried flowers and leaves from the cannabis plant, which we can see that at the picture at the right side. And then it contains mind altering, which is psychoactive compounds like THC, which is tetrahydrocannabinol, and as well as other active compounds like cannabidiol or CBD, which is CBD is not mind altering. So the THC, we move to the next slide, which is THC, tetrahydrocannabinol, which is marijuana's plant primary component for causing the psychoactive effects. So this component that causes the acute toxicity and produce some symptoms that has been mentioned in the trigger. Never mind, after this there will be more explanation on the effects of this marijuana. So common types of how they consume the marijuana. So there are many ways of using marijuana and each one affects users differently. Marijuana can be rolled up and smoked like a cigarette, which is there are two types, a joint or a cigarette, which is a plant. Never mind, I will show the picture after this. And then marijuana can also be smoked in a pipe, and sometimes people mix it in food and then eat it, or it can also brew it like tea, which is marijuana is edible. They put the ganja, which is the marijuana, in like gummies, chocolates, honey and more. So next, we can see the difference of the joint and blunt. Basically, both will be inhaled by the smokers. Comes to the next question: can people get addicted to marijuana? So the answer is yes. About 1 in 10 marijuana users will become addicted, and it can wasn't the case if the people begin using before the age of 18. That number will rise 1 to 6, which is if underage takes the marijuana, then they will be more easier to get addicted.
Next, let us proceed with the route of administration. There are two ways, which is inhalation and ingestion. For the inhalation, after inhalations of marijuana smoke, onset of psychoactive effects occur rapidly with peak effects felt at 15 to 30 minutes and last up to 4 hours. These effects mirror plasma delta 4 tetrahydrocannabinol, which is THC, concentration. Approximately 2 to 3 milligrams of inhaled THC is sufficient to produce drug effective in knife user. Pulmonary bioavailability varies from 10 to 35% of an inhaled dose and is determined by the depth of inhalation along with the durations of puffing and breath holding. Next, for the ingestion, when compared to inhalation, cannabis ingest has a delayed onset of psychoactive effect that range from 30 to 3 hours. Clinical effects may last up to 12 hours. Orally administered cannabis has low bioavailability, which is from 5 to 20% of the chemical degradation in gastric acid and substantial first pass metabolism in the liver. In knives user, a psychotropic effect occur within 5 to 20 minutes of ingestion of THC. As for this case, it's mentioned that it heals something. So from the case, we know that the way of administration is by inhaling. Next, let us proceed with the dose level of marijuana. First is by mouth. As for the multiple sclerosis, it's only use 1 to 5 capsule containing cannabis extract, standardized, which contain tetrahydrocannabinol, which is 2.5 milligram, and cannabinol 1.8 till 1.8 milligram twice daily for 12 weeks. As for a mouth spray, for multiple sclerosis, a specific cannabis extract product is being used and it's standardized to contain 25 milligram per milliliter of tetrahydrocannabinol THC and 25 milligram per milliliter of cannabidiol CBD has been used daily for up to 2 years. And as for smoke or use in the vaporized, which we can consider as inhaled, for nerve pain, inhaling cannabis that contain tetrahydrocannabinol THC has been used at least once per day and up to 3 times per day for up to 2 weeks. As for this case, the dose level are unknown because it's only mentioned that it's inhaled something only the night that he have the party. So there are no history of the patient to conclude that he had the large amount of substance intake.
So moving on to the next subtopic, which is the effects of marijuana, which is the important things that we need to know. Our group members will explain more about the short-term effect, the cardiovascular system, and also the effects to our brain. I will explain more about the short-term effects of marijuana. So basically, based on my research, according to the Marijuana Policy Project, 10 milligrams of tetrahydrocannabinol, which is THC, is the standard dose per serving. So anything below 10 milligram of THC is considered as low dose. And products that call themselves low dose will range between usually 1 milligram to 5 milligram of THC. So in lower dose, also we call microdosing, marijuana produces poor memory as it gives effect to the person to have short-term memory problems, then lead to the decreased ability to learn, difficulty in thinking and solving problems, and also will cause poor muscle coordination and judgment, short attention span, dangerous driving behavior, and it also altered the sense of time and space as it may lower the reaction time. After taking it, a sense of calm and euphoria may occur, and this alteration leads to a loss of bearings because the user feels sleepy or depressed and has no notion of time. All of this because the presence of THC, which is I mentioned before, tetrahydrocannabinol, which is the active constituent of cannabis, directly influences the brain function by blurring the connection between neurons. So never mind, this will be explained more after this by Sister Haja. So other than that, it may cause the user to have food cravings too, because it is able to increase one's appetite. So from the trigger, we also have the clue which cause him hungry, which is it increased the appetite of the users. Okay, so next we move to the larger doses. What happened? So marijuana produces hallucination, delusion, poor memory, express strange behaviors, seeing, hearing, or smelling things that aren't there, hallucination. So not being able to tell imagination from reality, psychosis, having anxiety attacks or feelings of paranoia, which is the user will have the sense of fear one is being watched or followed, and depression, and also it can increase the heart rate. Move on to the next presenter.
Okay, Assalamualaikum warahmatullahi wabarakatuh. My name is Muhammad Rizal Idahan bin Amanuddin with matric number 1912623. Okay, so I will continue the presentation with the effects of marijuana on cardiovascular system. So first we need to know that inside the marijuana there is a cannabinoid. The cannabinoid is a compound found in marijuana such as tetrahydrocannabinol. So this compound may cause us to having the hypertension or increase in the blood pressure. So this can lead to severe health complication and risk of heart disease, stroke, and sometimes even death. So the next cause is tachycardia. So tachycardia is a condition in which the heart is beating more than 100 times per minute. So for example, if we take the marijuana, even while resting, there will be an immediate jump in heart rate and cardiac work that can last for hours. Okay, so there is also several research done from the researcher to confirm the effect of effect of marijuana on cardiovascular system. So the researcher found that marijuana is dangerous for people with already having the heart disease. So for example, they state that the risk of having heart attack is higher after smoking the marijuana compared to the normal times. So in the United States, there also research done, and the report state that there is more than 2 millions of 89 million people in United States that who use marijuana will have the heart disease. So we can say that it is proven that the marijuana will cause an bad effect on the cardiovascular system. So I will pass to the next presenter.
Okay, so for the next part is how does marijuana affects on the brain. So after the marijuana is inhaled and enter his body, THC will travel throughout the body and it is including the brain. THC will attach to cannabinoid receptor on the brain's nerve cell, hence it will affect the cells by interfere with the ability of natural cannabinoids to do the job of fine-tuning communication between neurons, which can throw the entire system off balance. So because cannabinoid receptors are in so many parts of the brain, the effects of THC are wide-ranging. So for example, if it attaches to the amygdala, it can make someone feeling anxious, afraid or panic, such as our patient in this case. And then it is because of this part of the brain responsible for emotion and fear. Next, it can affect how the hippocampus and orbitofrontal cortex, neocortex, which is the part of brain area that enable a person to form new memories and transfer their attentional focus. As a result, using marijuana causes impaired thinking and interferes with a person's ability to learn and perform complicated tasks, and it can also trigger a user's sense and judgment to be clouded. Next, THC also activates the brain reward system, which include regions that govern the response to healthy pleasurable behaviors like sex and eating. Other than that, THC appeared to give the munches, which is the sudden strong desire for food, by convincing our brain that we're starving as our patient that he feels that he need to eat. The next part is neurological examination. So neurological examination is an assessment of a person's nervous system for the diagnosis of a neurological condition. So there are many aspects of the exam, and it is not compulsory to do all the examination, as it can be decided according to the doctor and the patient condition. So what is the condition for a patient to take the neurology examination? It can be done if the patient has a complaints of headache, blurry vision, changes in balance or coordination, seizures, tremors, and any other symptom of nervous system disorder. As in this case, the patient complained about having a headache and feel dizzy. However, in this case, it only focusing on the patient mental status examination and cranial nerve examination. For the mental status, we use the Glasgow Coma Scale or GCS, which acts as a measurement of a patient level of consciousness. It is a common system used in assessing patient level of consciousness by grading the severity of brain injury and serve as a supplement to the neurology assessment. This scale contains 3 categories, which are eyes opening, verbal function, and motor function. The GCS score is determined by adding all of the score of each category with a maximum of 15 and a minimum of 3. So the division of the score will be as follows. In addition, if anyone achieves a score of GCS 13 to 15, it sometimes does not mean that the patient is fully awake. It is due to there might be an alteration or disturbance for external stimulus such as drug and alcohol on the body. As mentioned in the trigger, that the patient's score for GCS is 50 means that the patient got a full score of all the parts, and that means he is fully awake. But due to the sustained inhale, the result might not be accurate. Hence, he might have the potential to get a lower score than what he gets. So for the next part is the nerve functioning. We use cranial nerve examination, and this cranial nerve has also been tested as part of the neurology examination, as it provides critical information about potential brainstem dysfunction. And then there are a total of 12 cranial nerve, and then the patient cranial nerve 2 to 12 are intact, which means that no damage has occurred to his cranial nerve and all of them are functioning well. However, several cranial nerves cannot be thoroughly examined since they have various functions, and this leads to the neurologist put the intact cranial nerve 2 to 12 as the result. And this intact cranial nerve implies that the cranial nerve exam was not performed, but the patient facial function is symmetric. Okay, that's all for my part. I shall pass to the next presenter for her to conclude all of these cases.
So for the conclusion, okay, so based on the evidence from the case, it shows that the male had an acute toxicity which is exposed to marijuana with the short-term exposure. And lastly, what is the Islamic perspective about marijuana? So there is one hadith. Every intoxicant is khamar and every intoxicant is haram, which is forbidden by Sahih Muslim. So the hadith conclude that drugs like marijuana, cocaine, and opium, which is intoxicants, are prohibited. So scholars state that narcotics like cannabis are forbidden due to adverse effect in personal health and social costs. Although cannabis is prohibited, it is allowed to use it for medical purpose. For example, cannabidiol, or we call it CBD. So CBD is used for reduce pain, inflammation, and anxiety. So it is not considered as intoxicant as long as there is no drug abuse. So I think that's all from our group. Thank you.